So for back pain, there are injection therapies that is one of the large ones that we can use. Usually back pain is because of an inflamed source somewhere. Either the facet joints, the little joints on the side of the spine, the nerves leaving the spine, sciatica classically, are irritated. By putting some steroid close to these, you're able to reduce that irritation. If there's no irritation, then there's no pain. In pain management, we're just a jump start though. So cleaning up someone's pain, getting their pain under control, allows them to change their lifestyle. You don't change your lifestyle, pain's going to come back. So most of the time, most of our lecturing, most of our soapboxing is more so on you need to exercise once we get this done. You need to do things to strengthen yourself. You need to change your lifestyle, whether it's going to yoga or Pilates, to get things going. But if we can jumpstart somebody, and it's very rare that we find a patient that a little bit of steroids to a spot, and someone that hasn't had no other injuries, no other surgeries, a simple patient, doesn't reverse the process and allow them the opportunity. Whether they take that opportunity or not, that's the key to this and be able to do this. For more difficult patients, say someone that's had back surgery and is still having significant pain, we have a lot of techniques now. The most exciting, I think, is something called spinal cord stimulation, where we actually put electrodes into the epidural space, stimulate the spinal cord to use electricity rather than medication to treat the pain. It's a white noise generator. It puts so much noise up through the spinal cord to the brain that the brain does not sense the pain anymore. Implanted, it's sort of one of these set it and forget it. There's a generator like a pacemaker that's underneath the skin. You turn it, you set it to the settings that you want. This white noise goes up to the brain, confuses the brain so it doesn't sense the pain. These are for patients that don't have a injury. Surgeon has looked at this, said, boy, this is beautiful. There's nothing wrong with the nerves. You're not injuring yourself. So we can do this and allow the patient, again, to be able to get back to increased activity. And if they can get back to the increased activity, then they can get their pain better controlled by themselves without external influence. Plasticity is the word that it will get around, and because it's electricity and because we can change the frequencies of electricity. My patient, 18 years, I think, is my longest, my oldest patient with a spinal cord stimulator that's still working for them. Still get my Christmas card every year from them. I was using a elevator operator. Weights were too heavy, blew out his back. Had 3 surgeries on his back, I believe. Some epidurals that gave him some temporary relief. Then we went to the spinal cord stimulation. He was actually able to get back to work, which was sort of fascinating because he had been out of work for about 3 years with this. Not lifting the heavy weights, not doing those type of things, but after he was able to do exercise, he was able to get back to a reasonable existence, different job, but feel that he's doing something and helping it back into society, which for him was just a great thing.